guys, I'm Aaron Jones, student physical therapist assistant at Jefferson State Community College. Today I'll be discussing with you my patient case. My patient is a 19-year-old female, 3-day status post right anterior cruciate ligament repair with a bone patellar tendon autograft. She states that she injured her knee playing intercollegiate basketball 1 week ago. Her primary goal is to return to basketball so that she can keep her scholarship. Let's talk about some objective measurements. Her hamstring length is 55 degrees on her right knee, and her hamstring length for her left knee is 70 degrees. So we'll address that later on in our video. Okay, and let's talk about the circumference of her knee. Her circumference of her suprapatellar and infrapatellar border for her right knee is 2.5 centimeters greater than her left. All right. Now let's talk about her knee when it comes to palpation. Her right knee is warm and boggy with edema. We'll address this later on in our patient education. Here we're going to do our mobility technique. It's the soft tissue mobilization of the hamstrings. I'm here with our patient, Mr. Seth. He's going to stand in and help demonstrate this technique. Okay, what we're going to do is we're going to do a soft tissue mobilization, longitudinal. We're going to do some elongation of the hamstrings. The reason we're doing this is we're trying to relax the hamstrings so that it does not affect the complete extension of the knee. And some objective measures that cause us to do this are the hamstring length for this right knee is 65 degrees compared to the left knee, which is 75 degrees. Okay, so we're just going to do this technique to lengthen the hamstrings so that he can completely extend that knee. All right, we're just going to go ahead and I'm going to show you the technique. First, you'll apply some deep prep or lotion, something to reduce the friction. You just apply it here, and then you want to smooth it out. Okay? Alright, we're just going to smooth the lotion out. And while you're doing this, you can just go ahead and start a little bit of elongation. And you can get the tissue ready. What we're going to do is we're just going to do some elongation. You can press the leg on the hamstrings. You want to just press upwards. And while you're doing this, there may be some edema or swelling right here on the knee. This may push some of the swelling or the edema away from the leg. Okay, you can just use techniques. You can use several different techniques. You can press this way, and you can press this way. As long as you're pressing with the muscle fibers, like so. All right, you're gonna press up, push up. How's that feel, Mr. Thomas? Is that all right?
Feels great.
Good. And you can just doing this will help to relax the muscles and return them to their full functional length. All right. We're going to do some patient education. I'm going to educate Mr. Thomas, who is my patient today. I'm going to educate him to elevate his leg. All right, Mr. Thomas, I want you to keep your leg elevated about 12 inches above your heart, okay? Which is about how we have it right here, okay? You can prop your leg up on cushions or pillows. I want you to have the cushions or the pillow under your ankle and your calf, all right? I don't want you to have it under your leg here because I want you to have some pressure on your leg right there to keep it in extension. All right. This will help. This right here will help to press the swelling up towards the heart, which will get it out of the body. Okay. And this will also help with helping get your knee to full extension because gravity is pushing down on it. All right. You can do this anytime you're relaxing. You can be watching TV, or anytime you're relaxing, you can have your leg propped up here like so, and you just want to keep it about this height, and and extended. Those are two key points that we want to do, okay? You can do it throughout the whole day or just 2 times a day for 15 minutes, whichever you would like. It's just going to press that swelling up towards the heart and get it out of the body, okay?
Sounds good.
All right, some exercises that we can do at home, okay? First of all, we're just going to do the hamstring stretch. I'm going to demonstrate this to my patient, and then I'll tell you some things about it, okay? All right, Mr. Thomas, what we're going to do is we're going to sit on the edge of a bed or a table with just your right leg up, okay? And I want you to have your left leg hanging out. This will allow for a greater stretch than just putting both legs together, okay? What I want you to do is to bend at your waist, here, keep your back straight, lean forward. Don't worry about touching your toes, okay? I just want you to lean forward and feel a good tight stretch in the back of your leg. I want you to make sure to breathe throughout the whole exercise, and you shouldn't feel any pain. You could possibly feel some mild discomfort in your knee due to it still having some inflammation and you just had surgery. Okay, you should feel a tightness in the back of your leg there. All right. The reason we're doing this is because my patient has a decreased length of the hamstrings. He has a 55-degree hamstring length compared to 75-degree hamstring length on the left leg. And what this will do, this will increase the length of the hamstring as stretching, and we'll meet that goal. And we'll be able to meet other goals, such as range of motion and going up and down stairs. Okay? And what you want to do, Mr. Thomas, I want you to hold that for 20 seconds and do 3 sets 2 times a day for 5 days a week. Okay? Sound good to you?
I think I can
His
handle it.
prognosis is good. She has a right ACL repair, so she should return to full functional level. She wants to play basketball. She should be able to return to basketball, but she'll probably wear a brace since to protect the knee from any further injury. Again, her prognosis is good. I thank you for joining me today, and that is the end of my treatment plan. Thank you.